the immune system is weakened. So if you go too aggressive, too many targeted therapy, like you said, 2-3 places and all this thing, you're risking a lot of healing crisis. So some patient, those people who are using it for a lot of people, they might have some instance where the patient has headache and other kind of a digestive complaint after using the device initially. This is very common with anything that is effective to help in the healing process will create some amount of healing crisis. So the best way is recommend them to hydrate a lot. Take a lot of fluids, at least about 3 liters, 3.5 liters. Hydrate a lot, start slow, and then slowly, gradually build up over a course of about 1 to 2 weeks now.
Yes, doctor. How about the lung? Is it useful for the lung infection? COPD, the short form they say.
Just now the slide on the,
COPD,
on the oxidative stress. One of the studies conducted is also on COPD. Yeah.
Hi, doctor.
How many times a day?
Twice a day, 30 minutes, and then you can do target therapy on the lung.
Oh,
Yes.
you can do target therapy. Okay.
Yes.
And Dr. Ashwin, maybe you need your help to explain to us what is COPD,
Oh,
so
sorry.
that all of us will know what it is. Thank
COPD,
you.
chronic obstructive pulmonary disease, is a lung disease, which is basically where the patient cannot get enough oxygen and it's like hardening of the lung. The lung cannot expand so freely and so easily. So one of the way it works is on the border of the lung, and it should be able to help to expand the lung after
So this
that.
one is a new school.
Yes,
It's a day, twice or no?
twice with the nose release.
And targeting for the
Targeted,
lung.
yes.
Okay, thank you.
Hey, doctor. Yes.
Wow, mic, wait.
How?
Mic.
Ladies and gentlemen, we are welcome for all the questions, but before ask for any question, please get the mic first, yeah?
Doctor, regarding about diabetic 1 and diabetic 2, so my patient actually is diabetic 1, so seems like the treatment cycle is not that stable on diabetic 1. Will anything we can do to help on diabetic 1 patient on IM laser side?
So diabetic 1 is essentially a problem with the pancreas. So they would have to do a little bit of targeted therapy on the pancreas and also use the device on the hand twice a day. But I've used for diabetic type 1 also and got a good result with it. Yeah, it will take maybe about 2 to 3 months to start seeing some benefit. But the patient can reduce the dose of insulin because now they're using a high dose of insulin. Diabetic 1 means their body does not respond to the tablet so well, they respond to insulin. So they have to use it continuously.
Right, thank you.
Hi, doctor. I believe that using the ion laser is actually safe, right? But as a customer, they're also concerned. Is there any medical research that show that use the ion laser is safe? Because they're worried on the laser.
Yes, because the device is certified by Europe. It's got a Europe certification as a certified medical device, and German tech also medical device. In order to get this certification, has to be proven to be safe first. The first priority is the safety. The second priority is whether it's effective or not. Yeah.
Excuse me, my name is Kevin. I'd like to ask this question on using this light therapy for insomnia. Is there anything to do with the circadian rhythm, where the timing, especially some people do it at night, instead of getting better sleep, they may getting more active and cannot sleep. And the question is whether we can get better result if we close our eyes, or if we see any TV or things during the treatment, will it affect the efficiency?
The first question is for patients who have insomnia. Insomnia is a sleeping problem where they cannot sleep and they need to take sleeping pill or other supplement to sleep. So in order for insomnia to be effective, I recommend them to use the general device more in the morning and afternoon. By about 3 o'clock, try to not use the device until they get used to it. Because the body has an adaptation process. So as the body is adapting, use it more in the earlier part of the day would be better, because you don't want to overstimulate them. So sometimes insomnia patients already have a sleeping problem, and then they use something at night time. It can work both ways. Some patients, when they have a sleeping problem, they use the ion laser at night time, they actually feel that their sleep is improved. But some people take time to achieve that result, so recommended for them to use it in the earlier part of the day. So the second question was for
Close your eyes.
eyes. Okay, closing eyes. I haven't tried one.
You try, let us know. You try.
Maybe if you're more relaxed, possible that, you know, if you do a facial, watching TV, you do a facial, close your eyes, do a facial, I think facial will be more effective when you're more relaxed. So possibly, if you're doing it, that's why it's also recommended to do it when you're going to bedtime, if the lights are dim or you're reading a book or something, you can use the device before you go to bed. It's also a recommended time when you're more relaxed, possibly more effective.
Hi, I've got two questions. One is related to SLE. How would you recommend for people with SLE problem? Two is for people who've been diagnosed by doctor that have anxiety or depression, can these products be recommended? And in long term, do they still need to take the antidepressant pills? Thank you.
So for SLE, there are studies conducted for patients who have SLE who have used the laser device, and they have actually got good result. But SLE is quite a complex disease to treat, so they would still need to continue the medication that the doctor has prescribed for them. And I don't recommend people to completely stop using the treatment that they are already on when they start the laser device. To continue that and then be monitored by a doctor to see the condition is stabilized for them to slowly taper off. So what they can do is they can start off with the 1 bar 10 minutes and then hydrate a lot, because like I mentioned, for autoimmune condition you want to go slow. You can create a reaction in the body if you go too hard too fast. You have to go very slowly and very gradually. So you have to slowly increase over a span of about 2 weeks. Let their body adjust, then go for 3 bar 30 minutes with the nose piece twice a day to get a good result. Yeah, but definitely supposed to be effective for SLE patients. Then for the other question, for anxiety and depression, anxiety and depression, there are clinical studies that laser device is effective, but some patients who have anxiety, they have anxiety towards a lot of different things. So when they try some new therapy, they develop anxiety that is it going to work, is it not going to work, then they get tense up. So sometimes that can make them feel nervous about using a device, so also start slow. And to go off the medication completely, they need to be under observation from a doctor who's specialized in this field, and then the doctor can comment whether or not it's safe for them to go off the medication.
Ladies and gentlemen, last two questions for the Q&A session.
Hi, is it okay using the device during you having your meal?
Yes, no problem.
Okay, thank you.
Just don't spill any curry on it.
You suck lady one question. Go and take your meal.
Excuse me, doctor. My name is James Wong. I would like this patient who having this dialysis during for 1 week for 3 times. So how this low level laser is can be help them? They have one question is they say they cannot drink water, so much water in a day. So what's your advice, doctor?
Can use the laser device, and there are testimonies of patients actually improving using the laser device for dialysis patient. There's some testimony that the frequency of the dialysis, for example, going for 3 sessions a week, and some patients have found that they have an improvement. And also there are some testimony of patients specifically using ion laser, and they have found that there previously no urine. That is a very late stage of kidney failure, and they have actually still going for dialysis, but they have had a urine coming out after that. So some improvement in the ability to urinate, which also allow them to increase their fluid intake. Those compared to those type which is cannot pass any urine totally. So there is, but these kind of condition also start more gradually and see how the body adjusts and then slowly step up and can be used.
Okay, ladies and gentlemen, thank you, Dr. Ashin, for his interesting presentation. So we are now going for the tea break for half an hour. I will see you back at 11 at the same place here. Thank you.
Okay, sure.